Welcome back. Everyone gets headaches from time to time or pain in the neck, but when medication isn't helping and it doesn't seem to go away, that pain can become debilitating. Here to tell us how to manage it, welcome Dr. Jaime Robledo and Olga, an acupuncturist at Dr. Robledo's office. Hi there. So many people suffer from migraines and other kinds of pains, but they don't understand where it's coming from, so their only option is to go ahead and medicate it, and sometimes that just doesn't work. What are the biggest causes of those types of mystery headaches, if you will?
Okay, one of cervicogenic headaches is a headache specifically that has its origin in the neck. It's a headache that most people associate with muscle tension in the neck, comes to the back of the head, and then to the front. Yeah. It looks almost, and it feels almost like a migraine. But the source is different. So that's what we're trying to explain today, trying to make people aware that these are different kinds of headaches that require a different kind of treatment.
Yeah, which a lot of times will happen, like I say, if somebody had whiplash, and they might not associate with it that that's the reason why they're having the series of headaches.
The most common cause of cervicogenic headaches are people that have been injured, that have sustained an injury to the neck, whiplash, but it doesn't have to be just whiplash. Right. Just having your neck placed in an awkward position, with time will develop this type of headaches. Yeah. And these headaches are associated mainly with inflammation of some of the joints in the neck, especially the upper joints in the neck. Yeah, if you can see here, the C2-3 joint, which is right here, is highly associated with this type of headaches. When you examine a patient, usually by placing your finger around this area would actually trigger or feel like the type of headache.
And so a lot of times when we're thinking headache, we think the problem has to be all right here, or maybe even in the sinuses. Right. But this could be the originator of that. All right, so when it comes to treatment, what are we talking about? Because again, a lot of times we run to a pill, but it's about more than that.
Right. For cervicogenic headaches, there's a couple of ways we can treat this. Obviously, physical therapy is good. Mobilization and stabilization of the neck is important. When this fails and patients come to me, and many times they come to me because they say, well, my neurologist has been trying to treat my migraine headaches, and the medications are not working. Then identifying the source first is the first step. Second, we do a series of diagnostic tests. The first one, we take the patient to the operating room under fluoroscopy and under mild sedation. I inject the nerves that give sensation to those joints. C2-3 joint would be an injection here and here. Local anesthetic only. We send the patient home and we ask them, for the next 24 hours, tell me how you feel. Right. Is your neck feeling better? Are your headaches getting better? Or do they get better at least for that day? And if they come back and they tell me, my headaches are better, at least for the weekend or at least for 2 days, 1 day, I felt some relief. We repeat the procedure a second time, and in the second time, they come back and say, I got the same result. Then we proceed for the final treatment procedure, which would be a radiofrequency ablation.
And then those headaches, a lot of your patients say never have them again.
Well,
and then others have to manage it.
What I do is on the third procedure, we come back, and with a special needle, we place it right where these nerves are located, and we burn those nerves. We don't destroy the nerves. We only stop them from working. If it's done successfully, most patients get about 9 to 12 months of pain relief.
Oh, wow.
During that time, I always tell my patients, this is time for you to learn how to heal your body. Physical therapy is important. Trying to make changes in the way you position your head and the way you move your neck will be important, so these headaches will not come back and the problem will be resolved.
And acupuncture is a part of treatment as well.
Yes, correct. Acupuncture looks at every person as an individual. It's a completely different way of looking at any kind of disease. So you look at the source instead of treating just the symptoms. And when you take a pill, you really don't treat the source.
Yeah, you're just getting rid of the symptom, but the problem's still there.
So everybody can have the same symptoms and think, oh, I have a headache, I have a headache, I have a headache, so what kind of treatment will you give me? Everybody is going to be treated different because where does it come from? That's where acupuncture comes in, and that's the treatment with acupuncture.
Yeah, because like Dr. Robledo said, you said help the body heal itself, and with acupuncture, that's what we're doing, is helping the body heal itself.
I do believe that when we have exhausted all the conventional treatment choices for a patient, trying acupuncture and alternative medicine choices is a good idea.
Yeah, and the last thing is, if somebody is having a series of headaches, should they ask themselves some questions like, did I jerk my head in a way and feel something pop, or did I have somebody run into me and I didn't think it was a problem with whiplash? Because a lot of times with whiplash we think we're okay, we're fine, and we walk away. We don't see blood, we walk away. But so ask yourself a series of questions like, was there ever a point where you may have had some trauma to your neck and not realized it?
Absolutely. Patients that have been involved in a car accident and they feel fine, years down the road they might develop neck pain, they might develop headaches, and if they put 1 and 2 together, they say, well, maybe there's a different source for my headaches.
Yeah.
The classic patient that I see in my office, usually women between 30 and 40, have been involved in a car accident. They usually have long necks, and they have migraine headaches that are not well controlled with medications. And they look almost like a migraine headache.
Okay, we're going to wrap up with the fact that every women in your office has these animal print shoes, and I love that. Okay, Dr. Robledo has a special offer for new patients. If you call and mention you saw this segment on Great Day, the first 5 callers will get 6 complimentary acupuncture sessions. Acupuncture can help with weight loss, headaches, stress, just about everything. Give them a call at 281-727-0000, 281-727-0000, or log on to modulatepain.com, modulatepain.com. Up next, October is Breast Cancer Awareness Month. Getting a mammogram is one of the most important things you can do as a woman.